Hey, welcome to
Doceree Dialogue,
a platform that unites industry leaders
come together and exchange ideas, innovation, and insights.
shaping the future of healthcare marketing.
Hi, Dan.
Hello.
Welcome to Doceree Dialogue's podcast at Fierce Pharma 2025. We're super excited to have you on our podcast. Thank you for making the time to do this.
Thank you
We
for having
appreciate it. So, Dan, to kick things off, can you please introduce yourself, talk a little bit about your journey in healthcare, what you do at Office Ally, your role there a little bit, and just let's start off with that.
All right, perfect. In full disclosure, I have some notes just so it comes across as
No worries.
I can go for it. So I was at United Health Group Optum for about 12 years. And I focused a lot on partnerships with physicians, hospital systems, healthcare professionals for efficiency outreach more than anything else.
Yeah.
And through the multiple partnerships I was associated with at United Health Group, where it was more of a partnership to an acquisition.
Yeah.
So after about 12 years at United Health Group Optum, moved over to Office Ally. Been at United Office Ally for about 13 years.
Wow. Nice.
And I've been proud to see the increase of our offerings and efficiencies while still keeping our costs at a minimum to be the ally to that healthcare professional.
So cool. That is so cool.
Yeah.
Very nice. No, that's great. Thanks for sharing your background. Just kind of building on that. When you look at like point of care platforms, especially EHR platforms, what do you see as like the biggest pain points for providers and that you're trying to solve?
So for most of the office providers, healthcare professionals out there, the reimbursement has been decreasing over time from the payers, right?
Yeah.
So the biggest thing is the overhead cost burdens, too much information, information that isn't relevant at the point of care, right? So what we're trying to do at Office Ally, and I'm sure healthcare across the board, was easy to use, cost-efficient solutions to simplify the clinical and the RCM workflow, basically. And one of the benefits of cost reduction is also the relevant information at real or near time at the point of care, right after the point of care.
Yeah.
And what Doceree allows us to do is not only deliver that relevant information at the point of care, but also allows us, the partnership enables us to keep our costs low to, again, be the ally for that physician.
That's great.
So they're able to decrease their administrative costs working with Office Ally and focus a lot of that ROI time and cost into the patient, the member that they're working with.
Very cool. That's nice. That's a really important area that you're addressing, right? And shifting gears a bit. So you're here at Fierce Pharma Week. It's been a lot of fun. This is my first time here.
Yeah, it's wonderful.
I think it's a great conference. What drew you to this event?
One of the reasons is to meet with you and on this podcast.
So it's fun.
Yeah, exactly. Another thing is what I found at Fierce Pharma, and this is my first, although the company has been here previously, it is definitely a C-suite or decision maker conference, right? So you're having those one-to-one conversations. One of the things that I found at Fierce Pharma is connecting silos. And people always talk about, hey, we're going to break down the silos. Where truly what it is you have the silo of information.
Yeah.
It's creating a gateway to each of those silos and having these conversations with the companies that you might have heard of before or maybe didn't hear of. In your networking, you're finding out company A is interacting with company B, C, and you can partner with those companies to share relevant information. Again, what we always want to do is keep costs down for the healthcare professional and deliver relevant information, but curated information at the point of care. And what I found with it's allowing us to tailor our products, software development roadmaps, and to fine-tune strategies that will ensure the success of collaboration for the end user, which is the practice, the physician, the hospital organization, the healthcare professional.
Yep. Makes total sense. And let's talk a little bit about innovation, right?
Sure.
And I think there's so much potential disruption and innovation that's going to happen in healthcare. From your perspective, what do you think are like some of the most impressive developments that you've seen so far?
Well, we're also looking to partner more frequently with Doceree.
That's
right.
amazing. We love that.
Yeah, we enjoy that as well. A couple of things is utilizing real-time data to quickly and more efficiently offer solutions at the point of care, right? And we're getting to the part of real time or near time with the delivery, with the adjudication of claims, et cetera.
Nice.
So again, to move forward to decreasing that time frame to increase the ROI in healthcare, and also partnerships that give companies a platform to bring other drugs to market, right? And offer that relevant information that offer better outcome for the patients, but offer it to the physicians so they can easily digest it either at or right after the point of care.
Yeah.
And this conference and these types of partnerships allow us to do that, right? And you're always constantly looking at the expansion of the data for data-driven solutions and new pharmaceuticals to allow for minimizing hospital stays, better healthcare outcomes, decreased healthcare costs across the board. And this, our partnership, but also Fierce Pharma, it looks like in terms of the conversations we're having, that's something that's easily attainable for every company that's here.
Yeah, no, 100%. Completely agree. What about like some of the gaps that you still think that are there in the industry? There's still lots of gaps, but what do you think are some of the top ones that we need to address?
I come from a data background and also with my background at United Health Group and then working with Office LA. And right away when I came in, I worked with a lot of health plans in the marketplace. But when I hear gaps, it's gaps in care, right? Yeah. And the way I look at it as you have a member of that has been with United Health Group, Cigna, et cetera. When they're live at their new insurance company that they're with, they may not necessarily have all the gaps that were filled, colonoscopies, mammograms, et cetera, brought with them. So there's duplicative processes that double up the cost in healthcare. Yeah. And what we're able to do, what healthcare is able to do, what a lot of this real-time reporting or near-time reporting allows the healthcare professional or that health plan to know that gap in care was taken care of. It was at this data. You get the relevant information to them, and they're able to then check that box that has been taken care of with the data that's associated with that, rather than having that member coming in and duplicating that care, thereby rising the costs in healthcare. So, it's in many respects, I think there's a lot of the answers are going to be different based on the background. Yeah. When I hear gaps, it's always the gaps in care, because if you can close those, then you can focus on that individual's healthcare and that healthcare journey.
Yeah, 100% agree. On the broader note, so when you look at like pharma marketing, right? How do you see that influencing the EHR solution space, right?
Yep.
I know we've had like a 5-year partnership now, which is phenomenal.
Yep.
And you were so instrumental in getting that partnership off the ground. How has that shaped the thinking when it comes to like pharma marketing within the point of care platform?
Yeah, it's certainly for the better, because as our companies mature, the relevant information, the near-time, real-time information being passed back and forth, I've seen the partnership grow with Doceree. We were one of the very first partnerships that you had, and it was basically just about 5 years ago in a few months.
Yeah.
I remember that kickoff that we had. Yeah. I believe it was 2000, right?
Yeah.
So again, I'm going to sound like a broken record, but again, it's delivering I've seen that partnership grow, and I've seen our healthcare professionals benefit from that because again, it's relevant information at the point of care, curated, not confusing, and then easily disseminated from that healthcare professional to that member, the opportunities, the options that they can have in the drug therapies that they're on, the options that, hey, you're on this, but there may be a better platform or maybe a better, for lack of a better term, there may be a better drug therapy for you that may offer better outcomes. Would you like to try that? And again, we're not having that conversation, but we're passing around that information for us to get to that MPI or that physician, that healthcare professional. And that can be the mid-level that's also talking to them, either a physician assistant, nurse practitioner, the nurse, the MA, et cetera. That information being easily digestible. A physician's not always going to be with that member 100% of the time in the office. But that message is going to be curated and easily digestible for whoever's reading that to give that information to that member.
Yeah, no, 100% agree. Let's talk. We can't have a podcast without talking about AI.
Yeah.
Right? I mean, it's everywhere. How do you see AI being used within the EHR platforms? What are you guys already working on or plan to work on? Talk a little bit about that.
Yeah. So, I'll have two answers. Number one, I'm not at the table at the moment for our AI discussions. Having said that, we're currently looking at AI modeling to enhance our physician experience and our partnership experience, right? So creating easier and better workflows when working with our patients. And that message also came from me, but from individuals within the company. And the neat thing is utilizing AI to, again, like a broken record, right? Creating efficiencies, decreasing ROI, and delivering more curated and targeted information to that physician and to that member, to that healthcare professional. And what we're going to be seeing is, like 2 years ago, we were talking about clinical trials, and that's probably going to be one of the things I'd like to talk about. But it was underrepresented people in clinical trials. AI came up, and immediately within 3 months it changed, and we're just seeing so much growth in that we're looking at the best ways to utilize that to enhance the healthcare experience and to enhance the patient journey.
Yeah. No, that's great. And then just kind of in closing, one bold kind of prediction for the next 2 years, some big innovation that's really going to revolutionize everything that we're doing in the healthcare space.
It's interesting, right? So again, we're going to be talking about AI,
Yeah.
and I don't have enough experience to know exactly where AI is going to take us next.
I know.
It's real world data.
It's changing so fast. We don't know.
With AI and real world data, there's always going to be the need for those individuals to review that data, to ensure that AI is getting that information correctly, and to create the content that allows it to respond back as efficiently as possible, and then to enhance that constantly, right? The other thing that I think is really important is in the clinical trial space, there's the underrepresented individuals in the clinical trial space that still need to have that information. There's most of the members either that aren't represented don't know about clinical trials or aren't aware that they qualify for clinical trials. And while that's not going to be revolutionary, in some respects, because it's something that's been talked about, surely if we focus on that for 2026 as an industry, you will have a better understanding of the healthcare outcomes for patients across the board. And you will be able to target on a pharmaceutical, we could be able to target on a pharmaceutical level the drug therapies that will be more focused for every individual, no matter what their economic, their social determinants of health, their economic background, right? Their medical coverage, Medicaid, Medicare, or commercial, allowing a better understanding of the entire patient journey for everyone across the board. And once we have that, then predictive modeling through AI is going to be much more simplistic. And then you're basically looking at, in many respects, you could have looked at genomic testing with the claims and understand. You can still take that information out, plug it into AI, and you can predictively, with analytics, understand the possible healthcare occurrences for those individuals in the future and take care of that before they occur.
Got it. Dan, this was amazing. Thank you so much for the insights. Really appreciate it. Appreciate the time you've taken to meet with us.
Thank you so much for having me.
It's so much fun. Thank you.
Enjoy. Thank you.